Thank you, Perry and the hotel team. Honorable Minister of Health, Dr. Aaron Motsoaledi, Honorable Premier of KwaZulu-Natal, Baba Sompisi, Deputy Minister of Health, Dr. Joe Pasha, MEC for Health of KwaZulu-Natal, Mam Nomakuku Smelane, heads of delegations of the G20 countries, invited guest countries, international organizations, UN agencies present with us, heads of departments, senior officials from both national and provincial government. My name is Sandile Buthelezi. I'm the Director General of the Department of Health, and I will be your Program Director this morning. And without wasting time, I present to you the member of the Executive Council for Health in KwaZulu-Natal, Mamus Melane, who will give us the welcoming remarks and in turn invite the Premier to give us a welcoming address. Thank you.
Thank you very much, Dr. Buthelezi, the Director General of the Department of Health. Good morning to the Minister of Health in South Africa, the Deputy Minister, Dr. Joe Pasha, our Honorable Premier, Mr. Tamintuli. I'd also like to welcome our delegates and greet all the delegates from the G20 member states, delegates from invited countries, delegates from international organizations, head of provincial departments and public health entities, members of the media, distinguished guests, ladies and gentlemen, good morning. In our language, we say sanbonani or sawubona. When you respond, you say yebo. Indeed, you are in a province of KwaZulu-Natal, a beautiful province that has summer all year round. Premier will speak on our behalf about the province. I will just give remarks about who we are and what is it that we do as a Department of Health in this particular province. The province of KwaZulu-Natal is largely a rural province with pockets of urbanization in certain areas. But despite the many challenges that we face, I'm proud to say that our department continues to punch above its weight, delivering essential health care to millions of people daily. Every day we ensure that healthy babies are born in our clinics and hospitals across the province, thanks to the hard work of our dedicated healthcare workers. Our dedicated team of healthcare professionals provides emergency care, performs critical surgeries, and offers ongoing treatment for people living with HIV, TB, and other diseases. Our hospitals use cutting-edge equipment, including CT scans, ultrasound machines, X-ray machines, etc. This technology, despite our limited resources, allows us to meet the complex healthcare needs of our communities. Our ambulances are equipped with life-saving equipment and are ready to respond to emergencies across the province. We are continuously improving our emergency response efforts to meet the demands of our diverse population. However, what we have is simply not enough. We do have a number of challenges in respect to financing a number of areas. The province of KwaZulu-Natal has a population that is just above 12 million. And in this province, we have 601 clinics and we have 69 hospitals. In as much as you might think that is a lot for a province that is our size, we do have a backlog of about 300 clinics that we still have to build in this province, particularly in the rural areas. When you look at the amount that each clinic costs, it clearly will take us quite a long time for us to be able to catch up on that backlog, and we continue to look for partners who will be able to assist us in that regard. We have three tertiary hospitals in the province of KwaZulu-Natal, but most of them are centered in the urban centers. We are currently working towards building a tertiary hospital in the north of the province. And because of the financial challenges that the province is faced with, we are in the lookout for partners on a PPP space. We believe that will assist and ensure that we are able to provide the service or clinic health services to the rest of the province. As a province, we are very firm on primary health care, and we decided to strengthen our primary health care primarily because we believe if you strengthen your primary health care, then you stop a lot of people from coming to higher levels of care when it's unnecessary for us to do so. We do have a number of programs that we are implementing that are ensuring that the primary health care is indeed strengthened and it does get to our communities. I just thought I should give that a short background and understanding, because I will not be talking about the province in itself. It is in a way of saying welcome. We appreciate having you in the province of KwaZulu-Natal. Ladies and gentlemen, can I then request that we welcome the Premier of this province, Mr. or Honorable Tamintuli, who is going to talk to us about the province and welcome us properly into the province of KwaZulu-Natal. Mpemba siyacela ukuthi uzobingelela. Thank you very much. Can we please welcome the Premier, colleagues?
Thank you very much, Ms. Nomakuku Smelane Mngadi, for the Department of Health in KwaZulu-Natal, the Honorable Minister of Health, Honorable Dr. Aaron Motsoaledi. I've forgotten to thank the Program Director, the Honorable Deputy Minister of Health, Dr. Joe Phahla, Your Worship, the Mayor of Ilembe, Councillor Shandu, distinguished G20 member countries, invited country guests, international organizations, the Director General of Health, Dr. Zimbali Conference, the Head of Department of Health in KwaZulu-Natal, and the DDGs, members of the media, distinguished guests, ladies and gentlemen. It is with profound pride and a deep sense of global solidarity that we welcome you to KwaZulu-Natal for this pivotal G20 Health Working Group meeting. The awarding of South Africa the privilege to host the first ever G20 summit on Africa soil this December stands as a testament to our nation's steadfast commitment to multilateralism and our growing stature as a trusted voice on the world stage. This historic moment reaffirms a timeless truth that Africa is the cradle of humanity, the land from which we all emerged and to which, in spirit and purpose, we must all return. As we convene in this land of Ubuntu, let us remember that the challenges we face, whether in health, development, or equality, know no borders. It is through shared resolve and unwavering partnership that we will forge solutions worthy of the people we serve. Ladies and gentlemen, the adopted theme of the South Africa's G20 presidency, which is solidarity, equality, and sustainability, is reflective of the readiness and stance we take into this important responsibility of hosting the world. As KwaZulu-Natal, we would like to register our full support for our country's approach to strengthening partnerships and expanding dialogue to shape a G20 that truly represent the hopes and aspirations of the people of the world. This approach of solidarity, equality, and sustainability confers greater legitimacy on the G20 and will give a fresh mandate to the 2025 Leaders Summit. The recommendations made by the engagement groups and for us today, the Health Working Group, will certainly give much needed impetus to the meetings of ministers and ultimately to the summit itself. As KwaZulu-Natal and South Africa, we cannot resolve many of the problems we want to address, such as poverty, inequality, and unemployment, without a sustainable health system. We therefore take the opportunity to acknowledge the work done during the German presidency in 2017, when global health was first included in the G20 agenda. This significant step underscores the political support needed for health initiatives and a proper consideration of the link between economic growth and health, or health and the economic system. Simply put, as we saw during the COVID-19 pandemic, sick people will not grow their economy, and a sick economy cannot develop its people. It is this umbilical cord that links the two, which must be stressed at his health working group meeting. It is our view that in our country, in KwaZulu-Natal, access to essential health services is a right for millions, and this should not be based on one's financial status or class. We therefore welcome South Africa's G20 health agenda that, in the name of us all, highlights the need for equitable multilateral solutions to address the health challenges on the 21st century. As often stressed by our Minister of Health, Dr. Motsoaledi, the move towards universal health coverage with primary health care at the center is the route to an inclusive, responsive, equitable, cost-effective, and efficient health system. Honorable dignitaries, esteemed guests, in times of turmoil, we are reminded of the profound veil of peace as we navigate the complexities of our contemporary world. We must confront the impact of reduced financial aid from the US. This unavoidable topic necessitates our attention, particularly in the context of our province's history. So we wish to use this opportunity to call for the rebuilding of relations with our second biggest trading partners. South Africa is a critical supplier of components for automotive converters. As we reflect on our shared experience and the challenges that lie ahead, let us recommit ourselves to fostering an international community that values the well-being, dignity, and human rights of all its citizens. As I conclude, it is my distinct pleasure to welcome you to the G20 Health Working Group here in KwaZulu-Natal, a province that embodies the essence of South Africa's natural beauty and rich cultural heritage. Our province boasts unparalleled a combination of stunning landscape, from the majestic Drakensberg uKahlamba to the breathtaking Isimangaliso wetland, both esteemed UNESCO World Heritage Sites. As you explore our province, you will discover the warmth and hospitality of our people, who are deeply rooted in the spirit of Ubuntu, a philosophy that reminds us that our humanity is inextricably linked. Our world-class infrastructure, including the Durban and Richards Bay ports, as well as the state-of-the-art King Shaka International Airport, positions KwaZulu-Natal as a hub for tourism, investment, and industrial growth. As you delve into the heart of our province, you will uncover a treasure trove of experience that showcase our unique cultural heritage, from the historic battlefields to the vibrant traditions of our people. Every moment spent in KwaZulu-Natal promises to be unforgettable. I invite you to immerse yourself in the beauty and warmth of our province and to join us in our quest to inspire hope and foster a brighter future for all. Thank you for your presence here, and I wish you a most enriching and productive experience in KwaZulu-Natal. With those words, I wish to humbly welcome all of you. Thank you very much.
Thank you very much, Honorable Premier Sompisi. Ladies and gentlemen, it's now my honor and privilege to invite the Minister of Health, Dr. Aaron Motsoaledi, a very distinguished health activist, a medical doctor, and he's been with the government since the democratic time came, and he's not for the first time the minister. He spent 10 years. They took him on leave to Home Affairs, but they brought him back now with the 7th administration. Over to you, Minister.
Program Director and the Director General of the Department of Health in South Africa, Mr. S. Buthelezi, His Excellency, the Premier of KwaZulu-Natal, Honorable Tammy Ntuli, my colleague, the Deputy Minister of Health in the Republic, Dr. Joe Pasha, and my colleague, the member of the Executive Council for Health in the province of KwaZulu-Natal, Noma Gugu Simelane, distinguished delegates from G20 member states and invited countries, representative of international organizations and regional economic communities, heads of delegates, distinguished guests, ladies and gentlemen. It is a privilege to welcome you to South Africa for the second Health Working Group meeting under our G20 presidency. This gathering provides a crucial opportunity for us to reaffirm our dedication to promoting solidarity, equality, and sustainable development. Our focus is clear: to advance global health equity and resilience through universal health coverage in a world facing unprecedented challenges, but also in stemming the tide of non-communicable diseases. Our work is inextricably linked to the Sustainable Development Goals, particularly SDG 3, which focuses on ensuring healthy lives and promoting well-being for all. And all means exactly that. It means all. We remain now with just 5 years before the 2030 deadline, a stark reminder of the urgency required to fulfill 2030 agenda for sustainable development. This agenda calls for a world where no one is left behind. And with such limited time, our actions must be accelerated and impactful and sustainable. The United Nations high-level meetings on universal health coverage in 2019 and 2023 were pivotal moments in affirming our commitment to universal health coverage. The 2019 high-level meeting emphasized the need for strong primary health care systems and sustainable financing. The 2023 high-level meeting further enforced the urgency of addressing health inequities and ensuring financial protection, especially in the context of global crises. However, the reality on the ground is deeply concerning. The World Health Organization has reported a significant regression in universal health coverage indices. Specifically, UHC service coverage measured by indicator 3.8.2 has seen a decline, with global averages stalling and in some regions even regressing from previous levels. Similarly, financial protection measured by indicator 3.8.1, has also been compromised, with millions more facing catastrophic health expenditure. For example, the recent WHO data suggests that the number of people protected from catastrophic health spending increased steadily before the COVID-19 pandemic. But since then, that number has been reduced by an estimated 100 million people falling back into financial hardships due to health expenses. The COVID-19 pandemic, coupled with economic downturns and conflicts, has disrupted essential health services and pushed millions further into poverty. This regression across both indicators underscores the fragility of our health systems and the urgent need for renewed action. We must reverse this trend and accelerate progress towards UHC. A strong primary health care system is the cornerstone of universal health coverage. It is where prevention meets early intervention, where communities are empowered, and where the social determinants of health need to be addressed. We must invest in accessible, affordable, and comprehensive primary health care for all. However, our ambitions are threatened by harsh realities of global economic constraints. We are witnessing a concerning trend, declining global health budgets simultaneously with rising costs. This is particularly acute in the global south, where many nations are burdened by unsustainable debt servicing. These debt repayments are effectively cannibalizing vital health budgets, leaving millions without access to essential health services. We must acknowledge that spending on health is not a cost, but an investment. I love repeating this again and again and again. Who believe that healthcare financing is an expensive business, I keep on reminding them that if you want to see economic decline, disinvest in health. Because a healthy population is a productive population. We need innovative financing mechanisms that prioritize health, even in the challenging economic times. In 2009, the G8 already coined the slogan that we, open quotes, need more money for health and more health for the money that we spend, close quotes. This includes, number one, increased domestic resource mobilization. We must advocate for greater allocation of national budgets to health, ensuring efficient and equitable spending. Number two, debt relief and restructuring. For many nations, debt relief is not a luxury, but a necessity. We must explore mechanisms that allow countries to reallocate resources towards health. Number three, international partnerships and innovative financing. We need to strengthen global health partnerships and explore innovative financing mechanisms to bridge the funding gap. Efficiency and transparency, that's number four. We must ensure that every dollar spent on health is used effectively and transparently. In South Africa, we are actively pursuing transformative strategy to achieve universal health coverage through our national health insurance, or the NHI system. The NHI is designed to provide financial protection for all, ensuring that access to quality health care is not dependent on one's ability to pay. It will also assist in the efficient utilization of available resources by pooling funds and strategically purchasing services. The NHI is a concrete demonstration of our commitment to leaving no one behind, fostering equity and strengthening our health resilience. It is befitting to quote one of the most eminent personalities in health and medical care, the anthropologist and physician from Harvard University, Professor Paul Farmer, and I want to quote him. The idea that some lives matter less is the root of all that is wrong with the world, close quote. Crucially, we implore all G20 members to champion increased public financing of health systems. This is not merely a budgetary issue. It's a fundamental investment in our collective future. We must prioritize public health over competing interests, ensuring that adequate resources are allocated to meet the health needs of our populations. Furthermore, we must all align our efforts with the provisions of the Lusaka Agreement, which emphasizes the importance of strengthening health systems and promoting equitable access to health care. By adhering to these principles, we can build more resilient and equitable health for all. Beyond financing, we must address the persistent health inequities that plague our world. Non-communicable diseases are a growing burden, particularly in low and middle income countries. We must accelerate efforts to prevention and control, focusing on multilateral approaches. Specifically, we must be doing the following: alleviate financial burden, restrict unhealthy food marketing, finance emergency health services, and accelerate cervical cancer elimination, the only cancer which is preventable. As we look ahead to the upcoming United Nations high-level meeting on non-communicable diseases, the agencies to stem the rising tide of these preventable conditions cannot be overstated. This meeting represents a crucial opportunity to galvanize global action and reaffirm our commitments. The discussion within G20 Health Working Group, particularly regarding health financing, multi-sectoral approaches, and the social determinants of health. May I also add the commercial determinants of health, a newly coined term which is not yet readily used often, can directly inform and strengthen the outcomes of the ministerial declaration expected to be adopted in November 2025 during the G20 Health Ministers meeting. By sharing best practices advocating our policy changes, and committing to concrete actions on issues like regulating unhealthy food marketing and promoting healthy lifestyle, the G20 can play a pivotal role in shaping a robust global response to non-communicable diseases and ensuring that the United Nations high-level meeting delivers tangible results. Ladies and gentlemen, the time for action is now. We must move beyond dialogue and commit to concrete steps. We must prioritize health financing, address inequities, and work together to build resilient health systems. South Africa is committed to collaborating with all the G20 members to achieve our shared goals. Let us work together to ensure that health remains a priority, not a commodity, especially during these unstable economic times. I wish to end again with a quotation by Paul Farmer, and I open quotes. If access to health care is considered a human right, who is considered human enough to have that right? Close quote. I wish you a productive and successful meeting and look forward to getting succinct recommendations from these critical deliberations. I thank you.
Thank you very much, Minister. And ladies and gentlemen, I think we have reached the end of this opening session. As we allow our leaders to leave the room, we will remain seated and then we'll break for 15 minutes, and then we'll be starting with a closed session, getting into the actual plenary. So I would request that we allow our leadership to take the leave of absence, please. Thank you. All of us, we just remain seated, and as soon as they go out, we take 15 minutes physiological break, and we back down here in exactly 15 minutes, then we'll start with our first plenary. Thank you very much.